Hi everybody, Dr. Sean Casey here, answering your questions at Healthcare Complete Back and Neck Pain Center. Had a good question come across our computer the other day asking us, well, what does arthritis look like? What are they talking about when someone says arthritis or joint disease or damage? Well, actually, one of the great models we use in our office to explain this to patients, we thought we'd share with you as well. So in our first phase, we've got what's called textbook normal. So you can see here we have the big, thick bodies of the vertebrae that carries most of the weight. In between, you have these nice cushions called the discs. And if we look at the disc, really what it is layer after layer of ligament wrapped like an onion. And the center portion is a protein jelly that actually feeds that disc. And we'll make sure that disc is moving because that's how that nutrient gets to the disc. The weird thing about the disc, it doesn't have a really good blood supply. So normally the blood supply is going to carry nutrients in and take waste away. The discs don't have that like other tissues of the body. So motion's kind of the key, kind of like a sponge, pumping those nutrients in and out. And the disc is very important because as you can see back here, we've got the nerves branching out between those spinal bones. If we look this way once again, the brain might be up here and the spinal cord comes right down the spinal column and those nerves branch out between those bones, basically controlling all function and activity in the body. So this is a nice, healthy looking spine. Now, say someone's had an accident, injury, or just, a bad issue's gone on and those bones have got out of place. Well, gradually what's going to happen is a little more inflammation, not as much movement going on that disc. So over time, we can actually see a thinning or a decrease in that disc space. Now, in this case, it might be causing irritation, it might not, because the body's really good at dealing with stuff. It'll take whatever we throw at it and try and keep us moving, going, get things done, but we're using something the way it wasn't designed to be used. So that wear and tear is going to have a cost. And as we can see in this first phase, we're starting to lose in that disc space. Someone might have a lot of aches, pain, soreness, spasm. They also might not. The body does a good job of dealing with it, but it can only do so for so long. Eventually it's going to catch up to us, which is when we get into our next phase, phase 2. So this might be someone who's had issues going on for probably 10 plus years, and we see some big changes. So as I said, we know we need those discs moving to pump those nutrients in. We've kind of lost that over time. So we've really lost a lot of disc space. And you notice how those bones look kind of ugly. So these are what we always refer to as bone spurs, extra bony growth. What's interesting is we think of this as wear and tear, degeneration, and I would disagree. What we know about the bones of the body is the bones are growing. So just like when you work out and you challenge those muscles, you lift more weights or you lift a lot at work, your body actually builds more muscle to handle that workload. Well, guess what? When you're lifting as well, your body's actually building more bone, absorbing more calcium, more minerals to make up that bone matrix. But what's interesting about the bones is it's going to build bone where the stress is at. So if I have my bones lined up nice and even, I'm going to evenly build the bone. If that stress gets shifted to one side or another, there's more stress there. Gradually, my body's going to build more bone there. Actually, what we're seeing here is calcification of some of the ligaments that surround the spine. So in a way, it's your body trying to deal with a problem, but not a good thing, because one of the things you worry about is if these spurs start growing back toward the nerve roots or even the spinal cord, we need to talk to a surgeon to remove those, because obviously the bones poking on nerves doesn't work out really well for us. Unfortunately, sometimes people can just deal with this. They've had aches and pains for a long time. They assume that's part of life. It's not normal to be in pain, but we kind of get that thought, we just deal with it. As it keeps progressing over time, we can see some pretty massive changes. So if we get to this point where there's this massive compression on those nerve roots, really the only thing we can do with this is surgery. We are, in a lot of cases, fusing these bones together. The surgeon is actually digging out space so there's some room for that nerve to come out. Now the problem is these nerves are very, very sensitive. So if we have a long-term pressure on that nerve, that numbness, tingling, burning we hope is going to go away, might not. If you have long-term nerve damage, it can cause a lot of issues. And the part I want you to remember is these nerves control everything in the body. So a lot of times we think about nerve irritation as a numbness, tingling, burning in the arms, hands, legs. But these nerves go to your heart, your lung, your liver. So if we've got compression in those nerves, how do you think your heart's functioning, or your lungs, your liver? So that's why it's so vitally important to make sure we get as much normal, healthy motion in these joints, which is what we do as chiropractors. So hopefully this gives you a little more information on why we do what we do to keep you healthy. If you have any questions, give us a call. We'd be happy to answer them for you. Have a great day.